Now, medical rounds. It's an eye condition that affects millions of people. We are talking about glaucoma. And Dr. Geoffrey Emerick is an ophthalmologist at Hartford Hospital's Eye Surgery Center. And he's joining us live now to talk about 2 new treatment options for glaucoma. Thank you so much for joining us tonight, Dr. Emerick.
Thanks for having me.
Well, let's get started first by describing what is glaucoma.
So glaucoma, as you mentioned, it's a fairly common condition. It's caused by increased pressure inside the eye that gradually over time can cause some damage to the optic nerve, which is what carries the image from the eye to the brain.
What are the 2 new treatments that you're offering there?
So there's a lot of great treatments that we have and more on the horizon. The first one is called a trabecular microstent, and it's a very tiny implant that allows the fluid inside the eye to get directly into the drainage system. And it's done at the time of cataract surgery, only adds a few minutes to the procedure, and can help reduce patients' need for drops and help to lower the pressure.
And the second treatment?
The second is a little bit different. It's called micropulse laser, and it treats the part of the eye that makes fluid. And the great thing about it is it's non-invasive, there's no incision, there's no risk of bleeding or infection, and it can help patients who might not be good candidates for other types of glaucoma surgery.
Sounds very promising. What's the recovery time, though, like for both of these procedures?
So these are fairly quick. The nice thing about these is they're fairly minimally invasive. So the first one really just adds a little bit to the time of cataract surgery, and most people with cataract surgery are seeing great the next day and are back at normal activities within a few days. The other one with the laser, there's a patch overnight, but minimal pain or discomfort afterwards, and they're also back to normal activities very quickly.
That sounds so promising, and we certainly thank you for sharing that information with us tonight, Dr. Emerick.